welcome to the Indian Sun. I'm very fortunate to have with me Dr. Pallavi Sharma, one of Melbourne's most established GPs, specializing in cosmetic and holistic medicine, pediatric, geriatric, and preventative health. She was also the face of the 2018 Royal Australian College of General Practice's national campaign, "I'm not just a GP, I'm your specialist in life." I also have with me Joylakshmi, a client care consultant with Employment Assistance Program provider. Australia is once again in the news for the staggering numbers of cases and deaths due to COVID-19. Every 1 in 10 people are getting long COVID. So Dr. Pallavi, I'm going to just hand it over to you and ask you, first of all, what is long COVID?
Okay, now long COVID is defined as symptoms which are continuing past 12 weeks from the onset of the infection. So it's after 3 months if patients come back with symptoms of tiredness, exhaustion, foggy brain, not good with their concentration, memory, or not their usual self, what they were before. Their energy levels are totally different, what they were before, and not coping with life and often feeling really sad and run down. And that's the usual thing. And muscle pains and cramps become a part of life. They can't get over it. These are the very common long COVID symptoms, like they are short of breath on exertion. All these are common symptoms of long COVID.
I have a lot of questions on long COVID, but before that, I think I brought in Joylakshmi today because she's had quite a history with COVID. Joy, tell us all about it.
I think after listening to Dr. Pallavi saying about the long COVID, I think I have all the symptoms now. Now I think I realize, I think that must be the long COVID one. I had my COVID on the beginning of the year, the 1st of January. I started getting a pain on my wrist, like for 2 continuous days. And it was like excruciating pain. And I had fever as well. But I thought maybe it must be just one of my normal like body pain kind of thing that I normally get with my bones. So I took it. I took like painkiller a couple of times, like lot of time, in fact. But it didn't subside. It was continuous, like 2 days nonstop. I couldn't even raise my arms, my wrist. I couldn't use it at all. Then I started getting fever. I getting all those COVID symptoms. I got worried and I did a test. It came negative on the the rat test. But I still didn't feel good about it. So I got the test done. That's when while I was waiting for the results, I was still continuing having all the symptoms like fever, being lethargic and loss of appetites and everything. But after I got the results after 10 days, that's when they scanned the results as positive. But it took me more than a month to recover from COVID. I got the COVID in beginning of the year, but it took me, I think, mid-Feb. That's when I felt like better. But now again, I feel I still have those symptoms like foggy brain. I do, and sometimes I get breathlessness. I thought maybe that could be related to my high BP, but I'm not sure whether it's all related because it's very confusing to differentiate between a common flu and COVID, and especially with this season. But I'm getting all those loss of appetite and I get tired and I don't have any motivations to do anything. So yeah, it's very tough, maybe because with my life, with my work schedule as well, could be, but I'm not sure. To be honest, I'm a little bit confused, but what you have told us today, I feel I'm having that long COVID. Yeah.
And I suppose this is the sort of questions that people are asking because long COVID mimics a lot of illnesses and ailments. So, Dr. Pallavi, you would be getting a lot of patients like, I'm sure, Joylakshmi. And but my question specifically is, are women more prone to getting long COVID, as reports say?
Yes, that's right. The statistics definitely certainly give us an idea. Females in general are more prone. That's what the data has said us. And usually in women in the 40s and 50s are more prone for it. So there is a gender difference when it comes to long COVID and these symptoms developing in women. And there are various reasons for it. We can say that, yes, it's a gender difference in hormones also, which makes them also give a very good, robust response initially to recover. So they recover faster, but because of a different immune system, due to their gender also, they are more prone for it. This is what the data and the research has shown until now. Also, women are more integrated into families and into the society than men because they give a carer's role as a daughter, as a mother, as a teacher, in nursing professions. You can see childcare profession where majority of the females are employed and they are more vulnerable to catch infections from kids and people because they interact more in the society. So that does make females more prone.
Mm. So what is your advice to people with long COVID, general advice?
Okay, now as a GP, first of all, I always want my patients who have gone through long list of symptoms with long COVID disease, which is a big list, and they might not have all the symptoms, they might have few of them. Let them understand what actually long COVID means. Go through the understanding what they have approach to seek help until now. So once that is sorted out, then I always warn them right at the start that don't get basically, there are some people who will offer miracle cure. So I often tell them, don't hang your hat onto that. And please make sure you get the right professional advice. You've got to get your health optimized, a health checkup. Not everything is long COVID. So you might have other medical conditions. So get it checked out that your blood pressure, your diabetes, everything is under control. All other factors have been. So your health is optimized well with the GP. Also, I offer them other helps because now there are long COVID clinics available which weren't available before. So in Victoria, we have St. Vincent Hospital offering multidisciplinary COVID clinics. Sometimes patients would be happy to be referred there. I also tell them to link up with other patients who have been suffering from long COVID, and through social media, they can learn from each other's experience. Also, they might need psychological support due to long COVID symptoms, not that they have a psychological problem, but sometimes it's good, because of what the immense pressure they go through, a psychologist counseling will help them. Also, sometimes they are not able to have enough income in the family, so they are suffering financially. So approaching Centrelink is another important issue. Approaching a social care worker is also another good thing which I offer them. So it's quite a multidisciplinary approach with pains and joint pains and all that. I offer them physiotherapy, hydrotherapy. You can have meditation or yoga classes. All those support services are offered, but in different suburbs in Victoria, which is good. Monash in the southeast, St. Vincent Private Hospital is offering. There's Epworth Healthcare also offering long COVID clinics. So there are multiple resources which we really need to offer to our patients. And also the key thing I tell them, please budget with your health capacity. Work within your comfort zone. Patience is the key to success to get over long COVID. It will improve over time. Nobody can tell you when it will. It is a long journey. Be prepared. But remember, you have to not use your maximum capacity in day-to-day activities. So try to budget your energy levels. Only work within those limitations. Ensure one day you will get over it. There is quite a lot of hope. It's not a difficult path. Yes, initially the journey is hard, but with all the support, you will get through it.
Fantastic. I really wanted that. I wanted to know about the support system, which you've spoken in detail, which is really good. Joy, we have people like Dr. Pallavi, with all the expertise helping out. They are the vanguard of the system. Now, but then as an individual, what is it that people can learn from you? How are you coping?
In my thing at the moment, to be honest, I'm so tied up with my own work, my work schedule. I'm the way I'm coping is just firstly, I've never stopped using mask. So whenever I go out in the public, I always use my mask on. I always carry one extra as well. That is my thing. And also trying to keep my diet on a healthy diet. I don't use or I don't eat oily food now. I eat more of vegetables and some kind of meat, but I don't use processed food. I think that's very important because the last time when I just decided to go for a full body blood test done, I found out that I had I never knew that I had a sugar issues. Like I don't have a family history of diabetes, but my sugar level has gone up, and also my cholesterol has gone up as well. I'm not sure whether it is related to the COVID or is it related to my lifestyle that I've not been giving enough time to work out, exercise. But I think the main is any kind of symptoms that you get, of any common flu symptoms that you get, the first thing I do is get a red test done just to make sure, and that I don't have that COVID. But you never know, like you might get the second time as well, which I want to ask Dr. Pallavi as well, maybe later. And yeah, I think the best is to, be cautious, and whenever you go, just don't stop using mask. Yeah.
Yeah. Well, maybe Dr. Pallavi can answer that. You had a question for her?
Me to Dr. Pallavi or Dr. Pallavi for me? No,
you said you had a question for her.
Yeah. No. The thing was with Dr. Pallavi, I wanted to ask because I already had COVID. So what is when there is a likely a second chance, a person can get the second COVID while you're going through this long COVID time? Because with me, I've got a weak my immune system is weak. So I'm very, very particular about it. So even when I go out and, I travel, I use public transport to go to work, to commute to work. I get a little bit anxious when the train is crowded, when the public transport's a bit crowded. I get a little bit anxious. I get worried. But could that, sometimes the psychological also, if you keep thinking about COVID, you catch. That's what I feel. So I try not to be negative. I try to be positive. That's
okay. So sorry, do you want me to answer your question that how do you protect yourself from the next COVID infection?
Yes. And and also,
So in answering, protecting yourself from the next COVID infection is, first thing first, yes, you have to maintain your healthy lifestyle, have a proper healthy checkup with your GP. Make sure if you have any health conditions, whether it is asthma, diabetes, blood pressure, or any other disease, they are all being managed thoroughly and under control. So if you have basic good health, you will be maintaining a good immune system. Next thing, the most important paramount thing in the whole of pandemic we have been learning, as you said, yes, masking yourself is number one, because protecting yourself, you can only trust your own mask. You can't trust other people if they are wearing a mask or not. So make sure you wear the best quality N95 or P92 mask. That gives the best protection, and that will give you lesser chance of catching second COVID infection. The next thing is vaccination. Make sure you boosted enough. So if you are, if the age group is 50, you can have the 4th dose, even after the 3rd dose. So make sure you're boosted enough around the winter time. So you can go back to your GP and make sure where you stand in your vaccination. And once you're boosted, you have, within 2 weeks, you will have extra antibodies to protect yourself from the current surge of infections. Then definitely social distancing and wearing a mask indoors is definitely a very wise thing to do. If you can afford a good ventilation, that's an icing on the cake. Always make sure ventilation is encouraged wherever you are. That's the small piece of advice I can give you now at the moment. We can go into details later.
I know we can go on and on talking about, because new things keep coming up every day and everybody wants answers to this or that. But I think we've sort of covered the basics. And Dr. Pallavi, any closing thoughts on long COVID?
Pardon?
Any closing thoughts, any last thoughts, anything that we missed out on?
I would definitely say if people are diabetic or if people have some rundown immune system, the best thing that has happened, antivirals are available. So this fearing that you will be hospitalized, you can reduce the risk of hospitalization, ICU admissions, and severity of the disease by antivirals, which are available to people who have very poor immune system and also people who are 50 and above. It's an amazing thing which has been in the box available for people at the moment. Apart from getting their vaccination boost of masking, social distancing, and ventilation, this is another icing on the cake which is available, and it should be encouraged.
Just another question on antiviral. I'm told that it's not on the counter. You have to have a GP's prescription for it. But so do you go to GP when you are tested with COVID, or do you go beforehand and just keep the prescription ready should you get COVID?
Now, antivirals are always prescribed in the first 5 days once you have tested positive.
Okay.
So you got to have a positive RT-PCR test to be allowed for the GP to be prescribing you antivirals. So in those first 5 days, if it's taken, it's most effective. Otherwise, it's not that effective.
Okay. All right.
And it's telehealth. You don't have to go face to face.
Okay, that's one question I was about to ask, but
the red test doesn't work. You need to go to the other test to get that prescription.
Certainly. The thing about RAT test is very important. When you have symptoms, often the RAT test can give you false negative results and a false sense of insecurity that, I have symptoms, but my RAT is negative. That's not COVID, but that's not true. False negatives are often found with home testing kit and RAT tests. Therefore, you've got to go and get an RT-PCR test to be 100% sure that you do have COVID or not. And once you're positive, you approach through telehealth to your doctor to get the earliest advice.
Mm-hmm. Perfect. I think that sort of sums up. It was so lucid and clear. Thank you so much, Dr. Pallavi. Thank you, Joy. Thank you for sharing your time with the Indian Sun. And Dr. Pallavi, keep doing the great work that you're doing. Thank you.
Thank you so much for having me on your program, and thank you to your listeners too.
Yeah.
Thanks a lot.
Thank you, Dr. Pallavi. Thank you, dear, for having me.
Thanks.
Bye-bye.
Bye-bye. Bye.